I'm Christine Fortman, the CEO at the Minneapolis Heart Institute Foundation.
My name is Michael Miedema. I'm the Director of Cardiovascular Prevention for the Minneapolis Heart Institute and the Medical Director for the Nolan Family Center for Cardiovascular Health at the Minneapolis Heart Institute Foundation.
I'm Ritu Saxena. I'm a cardiologist here at the Minneapolis Heart Institute, and I'm a researcher for the Minneapolis Heart Institute Foundation. I happen to co-direct our cardio-obstetrics program here at Abbott Northwestern, and I also am the past governor for the Minnesota chapter of the American College of Cardiology.
Heart disease is still the #1 cause of death for women. 60 million women in the United States have heart disease. That is your neighbor, that is your mother, that is your daughter, that is your sister. It is the person sitting next to you. And we want to flip that dialogue from heart disease to heart health. And that is what Hope, Health, and Heart is all about.
We know very clearly that for a while in the U.S., the rates of cardiovascular death were improving in men, but they were staying pretty much the same in women. Cardiovascular disease is responsible for more deaths in the U.S. than all forms of cancer combined. Yet we're very aggressive about screening for cancer, but we're not very aggressive about screening for cardiovascular disease. That doesn't make any sense.
We're not as hip as breast cancer. And don't get me wrong, breast cancer, as you know, is near and dear to my heart. But women with breast cancer end up surviving their breast cancer, getting heart disease, and dying from heart disease.
We know that stroke is responsible for more deaths in women than it is men, and hypertension kills more women than it does men. So we have clear evidence, clear stats supporting that we need to be aggressive with our screening for cardiovascular disease in women, but yet we haven't been as aggressive as what we should be.
80% of all heart disease, whether it be in my cardio-obstetrics world or in my general clinic or in the prevention world, is preventable.
There's not just one thing that causes heart attack. There's not just one thing that causes strokes. It's a whole multitude of things. And so to be aware of all your risk factors is really important.
Menopause does affect the heart, right? So that loss of estrogen, that loss of progesterone does impact our cholesterol, our plaque buildup, our blood pressure, our sanity.
Historically, we've done this calcium score, a heart scan where we look for calcified plaque. Now we're developing more and more technology where we can look at all the plaque. And it turns out looking at all the plaque is probably going to be even a better predictor than the calcium score.
We are embarrassed by thinking about heart disease because we associate it with our weight. The heart doesn't get embarrassed. It's not an embarrassing thing. The heart keeps a record of every risk factor and everything you do to it. And again, we can prevent most of the disease that we see.
I think prevention is going to continue to be a bigger and bigger part of cardiovascular disease in general and cardiology in general. And really, at the end of the day, the best way to treat a heart attack is to not have one in the first place.
Get your cholesterol checked, get your blood pressure checked, stop smoking, start moving. Tell everybody you know that heart disease is the #1 killer of everybody. If you have heart disease, don't be embarrassed about it. Share your story.
The Minneapolis Heart Institute Foundation really drives cutting-edge, leading research. We've got several studies going on, and really in the last 5 years or so, there's really been a focus on making sure we have as many women in these studies as we do men.
We should normalize conversations about cholesterol. We should normalize conversations about blood pressure management. We should not be afraid to ask questions. If you have a cardiovascular condition and a researcher, say myself, asks you to be a member in a trial, please do so.
We're in an era where there's a lot of information available. I would say sometimes too much information available. So having quality sources, good sources of community, good sources of people you can rely on, it's incredibly important. You need good sources for your information. And so events like this heart health event are incredibly important. Having good community is important, really help guides you in the right direction.